It's that time again. So, the last couple of weeks I've been talking about seeking peace and pursuing it. So, I want to go a little bit further for my little 1 minute about seeking peace. Last week I mentioned about how you seek your keys because they're not easily found. And so, how do I continue to seek peace? Well, there are people, places, and things that bring chaos and that will mess with your peace. You may be like, what is she talking about? I'm talking about when your phone rings, you look down at the caller ID, you see it's a certain person, and you know that they are going to bring drama or they are going to bring chaos before you answer the phone. These are the types of people and situations that you should consider putting a boundary around so that they will not disturb your peace. I'm not saying that you cut these people out of your life. There may be some people that you may need to cut out of your life, but not everybody. But you want to put a boundary around them because you don't want them to be able to take your peace. Because anything that takes your peace is something that you need to really look at to determine whether or not you want to keep it in your atmosphere or how much you want to keep it in your atmosphere. It could be people, it could be places, it could be things, it could be the news because the news is so negative that every time you watch it, you just get angry. So, whatever that is, I want you to make a list of the things that bother your peace, and whenever they come around or whenever you see them, they bother you. Make a list. And so you can begin to determine what you want to do about those things. If you're going to seek peace, you're going to have to actively do it. Okay? So today we are going to be talking about people that are under 65 or people that are not eligible for Medicare. That when you lose the Medicaid coverage, remember Medicaid is doing recertifications here in Michigan. It's going to start in June. People will be losing their coverage as early as July the 1st. So if you are not eligible for Medicare, then you do have other options. And today we're going to be talking about one of those options that you have, which is for under 65 people that are under 65. Or people that you could be over 65, but you're not eligible for Medicare Part A. So if you fall into one of those categories, then this time is for you. The first thing you need to know about these types of plans is that there are different stages of insurance. That should say stages of insurance. It's your deductible, it's your copay or your coinsurance, and your maximum out of pocket. This is really, really, really important for under 65 plans because the deductible is what you're going to pay until you have to pay your deductible before the insurance company starts to pay. Now that's not going to be true on things like preventative care. Preventative care is before the deductible, and so are mental health services. Those are before deductibles. But anything else, unless it's stipulated by the plan, you're going to have to pay that entire amount, that negotiated amount that the insurance company has negotiated with the provider. You're going to have to pay that entire amount until you reach that deductible. And some plans have deductibles as high as six, seven, eight, $9,000. So you're going to want to be aware of that. But once you've met your deductible, you go into what's called the copay or coinsurance portion. That's where you pay some and the company pays some. So the company is going to pay the majority of it because you may have a $10 copay, $20 copay, $30 copay for different services, or it may be a percentage. You may pay 10%, you may pay 20% for the different services, but the company is going to pay a lot until you reach that maximum out of pocket. Once you have met your maximum out of pocket, at that point, the company is going to pay the entire amount of your medical bills until January 1 of the next year or until the end of your year for the end of your policy period, I guess is a better way of saying it. So once you reach your maximum out of pocket, the company pays at that point 100% of your medical costs. Usually, the calendar is from January 1 to December 31st, which means that on January 1, your plans are going to start over again. So there are different types of plans. So the first, when you're looking at under 65, you have bronze, you have silver, you have gold, and they used to have platinum too, but we're going to leave platinum off. Well, the bronze plan is when you have a large deductible. That's when you're going to have that $7, $8, $9,000 deductible. But that's also going to give you your lowest premium. So the higher your deductible, the lower the premium. So with a bronze plan, you're going to have that really large deductible. So you really want to keep this in mind, because if you go to the emergency room, if you're in the hospital, if you have to have an MRI, CAT scan, the deductible is going to come into play, and you're going to have to pay a big amount before the insurance company starts to pay. With a silver plan, you're going to have a deductible too. It's going to be like a mid-sized deductible. It could be as high as 5,000, could be as low as 2,000, but you're going to have a deductible, and then your premium is going to be somewhere in the middle also. But if you're looking at a gold plan, those are the plans that are going to give you the smallest deductible. So it could be zero, could be 1,000, could be 2,000. But those are also the plans that are going to give you that higher premium. So the higher your deductible, the lower your premium. The lower your deductible, the higher your premium. So just keep that in mind as we continue to talk about this. With these types of plan, you're also going to have these different types of plans. You're going to have an HMO and a PPO. You're really not going to have the HMO POS, but you're going to have an HMO or you're going to have a PPO. With an HMO, you want to make sure that that you are going to doctors that are within the network. You're usually going to need a referral. The HMO is only going to pay if it's urgently needed care, and you're out of the area. Other than that, the HMO is not going to pay. PPO, you can go in network or you can go out of network, but if you go out of network, you're going to pay more. And usually there are no referrals that are needed with a PPO. So now let's talk more specifically about the marketplace, or Obamacare, some people call it. If you are eligible for help, there's two ways that the marketplace can help you to pay your premiums or bring down your costs. The first one is called additional premium tax credits or subsidies. Depending on your income and the number of people that are in your household, you may be eligible for a premium tax credit. What the premium tax credit does is it lowers the amount of premium that you have to pay. It does it one of two ways. You can either have the entire premium tax credit go to the insurance company and it will lower your premium the most. Or you can say, I'm not certain what my income is going to be at the end of the year, so I'd rather pay the premium up front, and then I'd rather take the money, the subsidy, as a tax credit. So when you do your taxes, you'll get a credit on your taxes for that amount. You either way you want to do it, but you do need to realize that there will be a reconciling on your taxes. What do I mean by that? That means that, say that you put that you're going to make, you approximate that you're going to make $30,000 this year, but you end up making $50,000. I mean, that's like a good problem to have, right? Because if you put $30,000 on your application, but you made $50,000, that means that there's a $20,000 difference, and that means that the marketplace gave you too much money. And if they gave you too much money, they're going to come back for that money when you do your taxes. So you may owe money back that they've given you if you've taken it, if the insurance company has been paid already with that premium. Hope that makes sense. So you want to be careful. You want to be as accurate as you can when you are estimating what your income is going to be. The second way you may get some help is cost sharing reductions. So if you are a lower income person, which a lot of people that will be losing Medicaid are lower income, you may be also eligible for cost sharing reductions. These are on silver plans. What that means is you will not pay the entire amount of the deductibles and the copays and the out-of-pocket costs. So depending on your income, you might be a 94, an 87, or a 73. That means that the marketplace is going to give you a cost sharing reduction such that you're only going to be paying about 6% of whatever that deductible is, or that out-of-pocket maximum. Your copays may also be lower with a 94 too. So if you're eligible for cost sharing reductions, this is something that you definitely want to look into. If you choose not to do a silver plan, say you choose to do a bronze plan, you may be able to get a plan that has a $0 premium. That's where those $0 premiums come in. You may be able to get a plan that has a $0 premium, But also keep in mind you're going to have that higher deductible as opposed to having to pay a premium and having that lower deductible with either a 94, 87, or 73. That's when it's really good to be able to talk to somebody, a professional, an insurance agent that can kind of help you understand your options and make sure that you're making the best choice for you as you're making that choice. So, financial assistance. How do you know whether or not you're going to get financial assistance? It's based on your modified adjusted gross income. So, as long as your modified adjusted gross income is less than 400% of the federal poverty level, you may be eligible for some financial assistance. It's also going to be based on the size of your tax household. Think of it this way. If you have more people in your household, your money can only stretch so much. And so the government is going to say, okay, there are 5 people in this household and they make $50,000, let's say. They need a bit more assistance than someone that makes $50,000 and there's only 2 people in the household. So you'll get more subsidy based on the number of people that are in your household also. So those are 2 things that you want to keep in mind as you are looking into whether or not you will be eligible for subsidies. Okay. So if you are not eligible, then there are other things that you can do. And we're going to talk about some of these next week. But you can go direct to the carrier. So if you go direct to the carrier, that means you don't go through the marketplace, but you're going directly to the insurer. They may have what's called off marketplace plans. With off marketplace plans, these plans are designed to be more reasonable. So the deductible may be a little bit lower, the premium may be a little bit lower. It may be a more reasonable plan for you. So if you're not eligible for any type of assistance through the marketplace, it may be something to consider for you. Also, you may want to consider short-term plans. I'm not going to talk about short-term plans a lot during this live because I'm going to talk about them next week. And I'm going to explain some of the benefits and drawbacks of short-term plans. So if you will just kind of check me out next week and we'll go over short-term plans because that can be an option for you too if you're not eligible for financial assistance through the marketplace. Okay, finally, again, just want to invite you to become a part of my digital community where I am sharing different. I have a digital magazine that shares different health tips and recipes and things like that. Would love to have you be a part of that, and that is my gift to you. Okay, well, everybody, it was wonderful talking to you. I know we went a little bit longer today, but that's kind of a lot of information. So if you have questions, comments, anything, please just leave them below. I'll be more than happy to help in any way that I can. All right. All right. Have a good day. I'll talk to you soon. Take care. Bye.